going to start recording this now. So Dr. Bryant, just to start off, why is it important now at the beginning of October for kids to get their vaccine starting, for their flu vaccine starting when they're 6 months old?
So the American Academy of Pediatrics recommends flu vaccine annually for everyone 6 months and older. And we at Norton Children's Medical Group also recommend flu vaccine for our patients. Flu vaccine is the best way to protect against the flu. It's important to get vaccine now because we want kids to have protection when flu season starts. Now, the general recommendation is that kids get immunized before the end of October, but now is the time because we're already starting to see flu cases. It's an early flu season.
So what is there a particular concern about this upcoming flu season? We've had a couple of relatively mild flu seasons, but why is this upcoming season particularly concerning for you and other doctors?
We have had a couple of mild flu seasons. And so I worry that some parents may have forgotten how bad flu can be in kids. This is predicted to be a particularly severe flu season. Now, it's always a prediction, but flu season is wrapping up in the Southern Hemisphere. And in places like Australia, they've had particularly severe flu seasons. In Australia, it's the worst in 5 years. What happened in Australia was a surge of flu cases and a surge in COVID-19 cases. This is the twindemic that we've been worried about for the last couple of years. Didn't really materialize. It seems like, though, it's happening now, at least in the Southern Hemisphere.
And a lot of these kids have not had exposure to flu, at least here in the US. Is that another reason why this is something that could be potentially troublesome for the upcoming flu season?
It is. So going into this flu season, we have kids who've never been exposed to flu and in fact have never had flu vaccine before. So they don't have any pre-existing immunity to protect them.
What about the vaccine rates in Kentucky? We know that has typically lagged the nationwide average. Do you have any insight into why that is or how we can boost that up?
Sure. So we know that over the last several years, immunization rates with flu vaccine have been dropping in children. They fell again last year. And immunization rates for flu for kids who live in Kentucky are even lower than what is reported nationwide. And so if we just take last year, for example, only 50% of kids 6 months to 17 years of age in Kentucky got the flu vaccine. Compare that to 55%, or perhaps a more recent number, 58% nationwide. We are lagging behind with flu immunization of our kids.
What are some symptoms of the flu for parents who might see this and are potentially concerned, and how can they schedule or how can they get a flu vaccine for their kids?
So common symptoms of flu are fever, chills, body aches, congestion, runny nose, cough, sore throat, headache. What parents need to know is that this is not just a cold. This is more serious than a cold. And in a typical year, thousands of kids get hospitalized with flu. Flu can be particularly severe in young children, especially those under 5, and in kids with other health conditions. If parents suspect their child has flu, they should make an appointment with their child's pediatrician so their child can be tested. In terms of flu vaccine, all of our Norton Children's Medical Group offices are offering flu vaccine, and we have plenty of vaccine available. I encourage parents to make an appointment with their child's pediatrician or primary care doctor.
All right. At this point, I don't see any questions in the chat. Does anybody have any questions? Feel free to open up their mics and ask away.
Hi, this is Myra from Wave. I don't know if you can hear me. Can you hear me?
Yes.
Okay, sorry. I missed the very top of the press conference because I had some technical issues, but can you just kind of tell us, just recap, just the importance of the flu vaccine? Why is it so important right now and what we're seeing?
Sure. So the American Academy of Pediatrics recommends annual flu vaccine for all people 6 months and older. And at Norton Children's Medical Group, we recommend that all of our pediatric patients 6 months and older get a flu vaccine. Flu vaccination is the best way to protect against the flu, particularly severe flu. Flu can cause severe illness in kids. And in a typical year, kids die from flu. Flu vaccine is really the best way to protect children.
Dr. Bryant, it's Paul at WHAS Radio. Can you hear me okay?
Sure, Paul. Hello.
Hello. Masks are no longer required in schools. What effect, if any, will that have, you think, on the extent of the flu this fall?
It may really increase transmission. So we know that historically, kids are very efficient transmitters of influenza virus. And outbreaks occur in school-age children, and cases in kids can really fuel transmission in a community. One of the reasons that we've had a couple of really mild flu seasons is because of all of the mitigation strategies we implemented for COVID-19. And now, as you point out, a lot of those mitigation strategies are not being practiced. So people are not routinely wearing masks in many settings, and masks aren't required in schools. One thing to know about flu is that you are contagious even before you develop symptoms. And so this makes it very easy for flu to spread in settings like schools.
Hi, Dr. Bryant. This is Bria Jones from WFPL. You were talking a bit about this twindemic that we've been hearing about. What are some of the risks that come with if someone were to contract COVID and the flu at the same time, especially in younger populations?
You know, it's a worry. We know that kids can be infected with more than one virus at a time. I don't know that we have a lot of data that being infected with flu and SARS-CoV-2 at the same time can cause more severe disease. But I think what we do know is that it can certainly make kids miserable. Both of these viruses can spread through families, through households, and really take a family out of commission for weeks at a time. So the good news is we have safe and effective vaccines for flu. We have safe and effective vaccines for COVID-19. Kids and adults can get their COVID-19 vaccine and their flu vaccine on the same day.
Any other questions? Dr. Bryant, was there anything else you wanted to touch on before we wrap things up?
I'll just ask Brea and Paul and Myra if those answers address their questions well enough.
Yes.
Yeah,
Yes,
thank you
Dr.
very
Bryant,
much.
thank you so
Appreciate it.
much.
I just want to thank you all again for helping us get the word out about flu, and helping us make sure that parents have the information they need to protect their children.
All right. And with that, everybody, appreciate your time. Dr. Bryant, appreciate your time as well. Keep an eye out.